Taoiseach, children and young people are being failed by our mental health system. For the last 3 months, since February of this year, young people experiencing mental health difficulties have been admitted to the paediatric ward at South Tipperary General Hospital. Today, as we speak here at Leaders' Questions, there are 3 such young people on the ward. There has been as many as 5, and the length of stay has been as long as 8 weeks. And the reason for that, Taoiseach, as you know and as I know and as we all know, is that there are simply not enough beds, inpatient beds, for young people with mental health difficulties. And the admissions to the paediatric ward at South Tipperary General Hospital is totally inappropriate. Nursing staff do their very best. They are kind, compassionate and caring, but they are not trained to provide mental health care. Parents, usually mothers, must stay on the ward overnight to give support to their children. And of course there are knock-on effects in delays of admission for other patients. So, Taoiseach, on a daily basis, young people with mental health difficulties do not receive the age-appropriate, timely services and supports that they need. This causes psychological and social damage to these young people and has a detrimental effect not just on themselves but also on their parents, their siblings, their schools and their communities. And of course it reinforces the whole question of stigma regarding those with mental health difficulties. The children and their parents face immense challenges to get an adequate or indeed any service. And because of this, many children carry those difficulties into their adult life. Now, Taoiseach, we all know what needs to be done. We have had report after report. The problem is that we've had no action on those reports and no action on those recommendations. So, as a reminder, Taoiseach, what we need to do to tackle this hugely important issue is we need additional inpatient beds for children and young people with these difficulties. We need 24/7 crisis intervention teams providing rapid assessment for those children and young people. We need a comprehensive primary care counselling service. And we need to fully staff the existing child and adolescent mental health teams. We also need to resource and to support, including financial support, for community and voluntary organisations working in these areas. And I believe also, Taoiseach, that we need a designated leader, something like a SAR, whose sole duty and responsibility is to drive the implementation of these measures to ensure that our young people get the service that they deserve and that they need urgently. Something like the cancer care services in recent times. And my question, Taoiseach, is very simple. When are we going to see these measures being implemented by your government?
Taoiseach, 3 minutes.
Deputy, first of all, I will ask Mr. Jim Daly to come back to you with some more detail after Leaders' Questions in relation to South Tipperary in particular. He is very much aware of some of the cases that you've referred to and has spoken, in fact, to some of the parents involved. Staffing and necessary skills shortages need to be addressed in the context of extra beds. 55 million euros of additional funding has been committed for next year to develop new services which involve 10 new beds in the Central Mental Hospital and 20 new CAMHS beds coming to the new Children's Hospital. So there is a recognition, Deputy, that there is a deficit here, and we are providing significant resources to address that. On the broader mental health services issues, funding this year is almost €1 billion, 910 million euros. That's an increase of about 200 million since 2012. In excess of 2,000 new posts have been approved since 2012, of which over 1,300, 66%, have been recruited, with recruitment ongoing for the remainder. The appointment of 114 assistant psychologists and 20 staff grade psychologists for primary care child psychology services is ongoing. So, Deputy, there are a whole series of things happening actually linked to reports that have been done, and that will represent incremental improvement all the time. But there are certain pressure points in different parts of the country, and I'm aware of that. This is a particularly sensitive area in relation to child and adolescent mental health services. But we are seeing significant increases in funding and funding commitments with the staff and beds that need to go with that. But the challenge is ongoing, and as I say, in relation to Tipperary in particular, I'll ask the Minister to come back to you with a more detailed answer.
1 minute, Deputy.
If the reply, but we simply can't continue to kick this can down the road, Taoiseach. It needs to be dealt with. These issues need to be dealt with urgently, and you referred to the matter of recruitment. There are currently 500 vacancies of psychiatric nurses in this country. But Taoiseach, I want to say as well that the position would be much worse but for the tremendous work being done by community and voluntary organisations right across the country. In my own area, there are many such organisations, including the River Shore Suicide Patrol, Taxi Watch, Seesaw, the Community Suicide Awareness Workers, and these are all operating on a voluntary, unpaid basis, and they do absolutely tremendous work. And there is huge frustration among these organisations. They feel left on their own to deal with issues that should be properly dealt with by the public mental health service. And these organisations need to be acknowledged, Taoiseach. They need to be supported and resourced, and they need financial support as well. But Taoiseach, we are failing to provide for our young people, and we need to do that urgently. It must become a government priority, and certainly we cannot and should not, and hopefully will not, kick the can down the road further in relation to this. These measures that I've mentioned need to be implemented urgently, not in the next budget, but as we speak, because this is something that is affecting young people on an hourly and on a minute-by-minute basis.
Well, can I reaffirm to the Deputy that certainly no one's kicking the can down the road on anything here. This is a programme of action which is very much already underway. The construction of a national forensic mental health complex at Portrane is progressing well and should be completed by 2020. Improvements are being made, for example, to counselling services, including new jigsaw sites in Cork, Dublin and Limerick, to bring the total provision to 13 sites nationally. A continued development of the community mental health teams and improved 24/7 response and liaison services are improving the contact within communities. An eating disorder care programme was launched in January 2018, which is patient-centred, both in terms of care and recovery. In line with the recommendations of the Vision for Change, the HSC has prioritised mental health needs of those under the age of 18. We're focusing on reducing CAMHS waiting lists and improving mental health teams. There's currently 69 CAMHS teams nationally. Minister Daly is working with the HSC and his officials to set up a national telephone and text line with in relation to improving mental health services, and the list goes on. There's a whole load of stuff happening in this area, Deputy, but there is a lot more to be done, and we do recognise that.
Thank you, Taoiseach.